Hello people, welcome to Sanjeevani United Against Cancer, your science-backed platform where we zap away fear and shine a spotlight on the facts. Now this is in partnership with Network 18, Federal Bank, Hormus Memorial Foundation and Tata Trusts. Did you know that nearly 70% of cancer cases in India are found way too late? It's way too late, and that's what we want to change. Let's swap stress out for science, flush away those WhatsApp rumors, and bring on early detection. This episode is all about breast cancer, the most common type of cancer among Indian women. But guess what? It's beatable when caught early. Whether you're a young woman, a super mom, a loving caregiver, or just someone who wants the very best for her girl squad, this podcast is for you. I'm Toya Singh, and joining me is your favorite mythbuster, the absolute superstar of science on Instagram, Dr. Tanaya Narendra AKA Dr. Cuterus. She's here to make health topics as easy as a trending reel. A big challenge, but we know that you do it every day. Dr. Tanaya, welcome. Thanks for being here with us on the show.
Thank you so much for having me.
If we can just take to you that first question. Every single day, it feels like we're hearing about more and more cases of breast cancer in the country. And I want to understand, for you as a doctor, how do you separate the headlines from the truth? Are cases actually growing every day? Give us the breakdown.
So I think there's two things to notice here. The first is diagnosis is also rising, which is why I'm so excited. We're talking more about early diagnosis. We're talking more about getting diagnosed in time and getting the right treatment in time. But of course, things have changed so much over the past whatever number of years. We have more exposure to toxins. We have more exposure to environmental toxins. We have this pollution. Our lifestyle is not excellent anymore. So all of these factors, of course, lead to an increase in the number of cancer cases we are seeing. But the good news is that the earlier diagnosis will lead to more lives saved.
Okay, so almost you're giving a two-pronged answer. You're saying more cases are being diagnosed, but also that could be a good sign because there's more diagnosis taking place.
Absolutely. Science is advanced, technologies have advanced, and we find it easier to find these answers a little bit earlier.
Okay, so doctor, I want to understand, when you take a look at the numbers, what do you see right now in terms of rural versus urban, that gap that exists? Obviously, one can assume that there's more diagnosis taking place in urban areas, but I want to know more about what the numbers say to you.
The numbers, I mean, there's a very stark difference between the urban and the rural status.
Okay.
We are seeing that because there's so much more infrastructure in the urban centers, there's more awareness as well. People are slightly more willing to talk about such issues. There is a huge difference in the number of cases that get diagnosed in time in, say, an urban setting compared to a rural setting where not only is there so much stigma, but there's also that lack of infrastructure and there's lack of awareness as well. People don't know what to look for. People don't know when to look for it. And then once they do know when to look for it, what is the way to look for it, they don't know where to go to get that diagnosis in time. So there is an absolutely mind-boggling amount of difference that is there. And I feel like with raising public awareness, we can probably tackle that problem in some way.
Okay, so you talked a little bit in this answer already about warning signs. And I want to just, the moment we think breast cancer, the first word that's probably already in everyone watching's head is lumps, right? That comes to our mind. Okay, tell us. That's obviously not the only sign. What are the other signs? And even when it comes to lumps, we're told, touch your chest in a certain manner. What's wrong about those instructions? What do we commonly get wrong when feeling for lumps? Break that down for us.
Okay, so in medicine, we always say lumps and bumps. We don't just say lumps because there are things more than lumps.
What's the difference? You have to tell us. Like, how does it feel?
So the thing to remember is that it's not just the breast that you're looking for. It's not just a mass that you're looking for. One of the first mistakes we make is that we squeeze the breast. Like we are maybe checking for, I don't know if you're maybe starting to see more of a gland tissue as opposed to an actual change in the normal breast architecture. So you don't want to squeeze. You want to use 3 of your fingers and you want to gently press and see. That's the first mistake we make. So I have 2 rules that I like to follow that are great for self-breast examination. The first is the ABC rule. We only check the breast. We don't check other areas where breast cancer can be reflected. So you want to check your A, your armpit, B, your breast, and C, above your collarbone. So if you check your A's, B's, and C's, you're covering a great idea of where you can see these lumps
and checking is just touching.
Yeah, so you want to do the 1-4-3 rule. So when
Love.
we were younger,
Yeah.
when I was younger, we used to use text messaging for like on a QWERTY keypad. So if you wanted to say I love you, you would say 1-4-3 because I is 1 letter, love is 4 letters, and then you is 3 letters. So if you remember the
Throwback
1-4-3
for
rule,
only a very specific group.
I
but
feel
yeah.
like it will help us, keep this in mind, especially because we are at that age where we need to start being regular with our self-examinations.
Okay.
So 1 week after your period, you want to do your self-examination. 4 parts of the breast you want to check. If you take your breast and you divide it into 1, 2, 3, 4 parts. So the 4 parts, and you want to do it with 3 fingers. So the pads of your 3 fingers, you want to check. And like you said, we always get stuck at the lump stage. We don't look beyond it. It's not just lumps we're looking for. We're also looking for skin changes. We're also looking for any discharge from the nipple. We're also looking for anything that looks obviously different from what the breast normally looks like. Sometimes the skin can start looking like that of an orange peel. It's called the pudy-orange syndrome. And all of these things are a great insight into things that may be going wrong. So basically, you want to know what your normal looks like. And when it's not normal, that's when you know you can see your doctor for it.
But I want to ask you, right now we've talked about self-examinations and we've kind of gone into depth there. But I know that there's an argument also around whether self-examination is the only right way. So should one look at self-exam as sort of the first step? How many people do you see in India who are actually doing that I'm assuming the awareness has grown in the last few years, you would have seen a change. But speak to us on that.
Self-breast exam, I think, is very important to know what your normal is. It's like looking in the mirror every single day. So if there's a new pimple, you know there's something different in your face. That way, it's important to understand your normal breast architecture so that if there is something different that doesn't feel like normal breast tissue for yourself, then you know that it's worth checking out. It is, however, not the only thing to rely on. It can be a great first step to get acquainted with your body and tackle some of that stigma. But after that, mammograms, very important, very necessary. And also getting clinical breast examinations, which means you get examined yearly or, every 2 years by a doctor or by a healthcare professional who can see if there's anything worth noticing over there.
Tell our audience, A, at what age should you start getting mammograms? B, at different ages, does the frequency vary? I assume it does. So what would your basic guidelines be for anyone watching?
I think what's very interesting to note is that India doesn't have any nationalized guidelines on when and how often these mammograms should be. So it's actually just recommendations that we have. We often call it opportunistic recommendations because there's no set structure that we're supposed to follow. Whereas compared to the West, where we have these very set structures of when it has to happen, how often it has to happen, when it has to start, they see a reduction in breast cancer rates by almost 20 to 40% because of early diagnosis, which means less aggressive treatment, which means more effective treatment. So the general recommendation is that you do a clinical breast exam every 1 or 2 years by a healthcare professional. And I always recommend, if you're a high-risk individual, if you have a family history, if you haven't given birth, or there's so many other risk factors, if you smoke, you should definitely start getting your mammograms as early as your 30s. And if you're an average individual, you should definitely start by your 40s.
So I want to ask you, because you said it already, kind of, in India, more cases of women in their 30s, fair to say, versus the West?
It's actually very interesting. We see that pattern in the data very clearly, that we do have an earlier age of diagnosis, but at the same time, it's often an advanced cancer that is diagnosed because we don't follow, or we don't actually have these screening guidelines in place.
Okay, I want to ask you, let's talk a little bit now beyond mammograms. Tell us a little bit about the different kinds of methods that are coming in, 3D mammograms, for example, AI. And again, AI has become such a word in the last few years, such a conversational word. But tell us a little bit about how these technologies are being used globally, how soon you see a lot of that technology coming to India.
I think it is coming to India quite extensively. We are seeing applications of this. We are seeing more and more advanced technologies coming to the hospitals here. With that said, there's also still so much advancement that is happening in the science that every day there's a new technology that can help us. There's less invasive methods that are coming in. There's cell-free DNA that we can, without getting too technical about it, with a blood test, we can often diagnose cancer as well now. So we are having these exciting new ways of getting earlier diagnoses, earlier screening, better screening, which can help us with less aggressive treatments, with better survival rates, and just better quality of life for the patient as well.
And your sort of timeline, or do you already see it in some of the country's top hospitals, this technology coming in?
It is definitely coming in, and with the AI assistance, we're often getting insights into things that the normal human eye maybe would miss because they're such fine differences that, when you see so many scans every single day, sometimes sometimes you do miss things. This can be a great addendum to your regular clinical practice.
Okay, so I'd also like if you could just break down for our audience, with cancer, the other thing that comes into our minds, any kind of cancer, is the stage 1, the stage 2, the stage 3. And there's a fear around that. Just break down for us in breast cancer first how the stages work, how that denomination works and that demarcation works. Just tell us that first.
So one thing to remember, and I'm glad you talk about staging, is because in India, we often get diagnosed at the later stages, which complicates the issue a little bit. And with earlier screening, we might, save that. And when people hear about stages, they hear stage 3, stage 4, and it's almost like automatic panic. So in order to understand this, I want to use an analogy. Okay. Think of cancer like an intruder in your house.
Okay.
If it's just, maybe if it's just at the gate, think of it as stage 0. So it hasn't, it's a small change that has happened. It hasn't permeated everywhere. Think of this intruder that has occupied 1 bedroom in your house. So now you're at stage 1. If there's more than 1 room, if there's 2, 3 rooms, then it's at stage 2. When it's spread all across the house, it's wreaking havoc in that one particular, house that it's in. So in the particular organ that it's in, it's completely wreaked havoc. It's chaos over there. Then it's stage 3. And when this intruder has, completely taken over your house and also now moved into the neighbor's house, which means that it is not a local thing anymore, it is spread into other organs as well, then it is stage 4. And the later the diagnosis comes in, the more complex and the more invasive the treatment gets.
Doctor, in a lot of people's heads, you hear stage 4 and you get scared, you get alarmed. Stage 4 has almost become synonymous with the word irreversible, rather. How correct is that association in medical terms?
So stage 4 basically means now it has spread to other organs, which means that there is more invasive treatment we might need. You may be able to target 1 organ, but you may not be able to target all of the organs wherever it's spread. And some, what is called metastasis. And some metastasis is a bit more difficult to treat compared to other metastasis. So yes, it is a point of concern, but that doesn't necessarily mean that, it's completely irreversible or there's no way that you're coming back from it, which is why screening is so important, that we diagnose it a little bit earlier. Think of screening like, say you get an annual car maintenance every year. It's like that. What happens in India, on the other hand, is that instead of getting that annual car maintenance, we go to the garage when, the car starts making a funny noise. We don't want to let it get to that stage. We want to get the annual maintenance plan, which is why screening is so important.
Okay, let's move now slightly to treatments. When one thinks cancer, the most obvious is chemotherapy. And I want to ask you to just walk everyone through the different kind of treatments that exist. Tell us a little bit about what a doctor's course of deciding is. And also tell us, because I think this is more interesting, in the last few years, have treatments become gentler in any way? What is the progress? What does it look like? Because chemo inherently means harsh for so many of us.
Chemo is actually quite harsh, but the thing is, it's very good at doing what it's supposed to do. But there's a little bit of collateral damage. So think of chemo like, there's a war and you're dropping a big bomb. So you will lose your own people as well. So you will lose your own cells over there. But at the same time, it's great at getting rid of the intruders. So it's very, very effective, and that is why we continue to use chemo now. But it's not the only option. So bearing in mind the patient's stage of cancer, their particular biology, there's many things that we check for when we check for cancer now. There's immune methods now, there's immune modulating methods now, there is, of course, radiotherapy, there's surgery, there's chemotherapy, there's so many new advancements that are coming in. So we take all of these things into consideration when we decide the best course of action. And the thing is now that medicine is getting a lot more personalized, which means it's less brutal, but a lot more effective. And it has gotten better over the past few years, of the past couple of decades, with more medical science advancing, with more personalized treatments. And of course, the buzzword that we're seeing so much, AI coming in, there's better data reading patterns that we're able to see now. So it is getting better. And I'm hopeful that it will continue to get better.
Let me ask you a follow-up question there. Is there a kind of treatment that you're particularly excited about, in the sense that you read about it and you're like, this could be gentle and this seems promising?
I'm actually quite interested in seeing all the new vaccine updates that are coming in, because we're seeing more and more ways of preventing cancer and also targeting cancer using mRNA technology. So it is a very exciting time in cancer research.
Women watching almost want to hear a promise from you. And what I mean when I say that is, again, breast cancer often for many of us automatically means losing a breast. It can mean problems in childbirth, for example, childbearing complications later. Are there things that you can say have concretely changed from 10 years ago?
Oh, so much, so much. We have so much of advancement in fertility preservation itself, that just because you're undergoing, chemotherapy or you're going through radiotherapy doesn't mean that your future fertility is compromised. You may be able to protect it, you may be able to save it. And also, of course, I know that cosmetically breasts are such an important part of, how we present as women. And it is obviously a very real threat that the surgery may change your appearance. So we have great advancements in how these cosmetic surgeries are happening, how these reconstructive surgeries are happening. In fact, there are particular tattoo artists whose entire specialization is in reconstructive breast work. So it is getting very, very encouraging.
Dr. Cuterus, let's take to you now the big money question. Why are treatments still so expensive? Because we're talking about all of these advancements, but in a sense, the most important advancement of the price falling, that isn't happening, it feels like, in the speed that it should. So talk to us about that. Also tell us, are there government schemes that you're aware of that you think are brilliant that more people need to use?
There is so much advancement that is happening in the science, and that research takes a lot of money, which often reflects in the kind of prices we pay for, cancer treatments. It is expensive, yes, but it has gotten better actually over the past couple of years. And as we make more advances, as we make more templates for, quicker drug development models, it will get better. If we screen earlier, if we diagnose earlier, there is less investment that goes into it, because the treatment is less invasive, the treatment is less expensive, the treatment is more effective, and it's of course less brutal, not just on the patient but also on the pocket.
But I want to understand from you, tell us, in the last few years, the amount women talk about it, because that in India, that sort of, I don't know if you would call it shame, fear, but women take a lot of time to come out and talk about it to their partners, to the people around them. I'm sure you're seeing that changing, but what do you observe in clinics around you when you speak to doctors?
I think one very encouraging thing that I've seen lately is that there are dedicated breast cancer surgeons, or breast surgeons actually overall, coming up in cities outside of Delhi as well. It's not just in a Delhi, it's not just in a Mumbai, in a Bangalore. Now, tier 2, tier 3 cities are also seeing dedicated breast surgeons, which means that there is that demand that is going up. There's more people that are getting more proactive about their health. So there is a huge shift that has happened, but with that said, there's still so much stigma around, talking about cancer, which is already such a stigmatized word, combined with talking about breasts, which is also such a stigmatized word. So, together they do make quite a taboo conversation, but it is getting better. I feel like I keep saying this, I'm just so optimistic about how healthcare has changed in the past couple of years. It is definitely getting better, and more people are talking about it.
Okay, what about men though? And I ask you because men and breast cancer, it feels like, is a bit of an under-discussed story. What are the numbers like there? The more basic question, can men get breast cancer? And what are the numbers like there as compared to women?
So out of all the breast cancers that are there, about 1% are actually in men. And this is something that a lot of people don't know, that men can also get breast cancer, because there's that stigma around breast in general, combined with men's healthcare and the stigma around it. So it is very much there, and the same way as women need to, do self-examinations, men should also do it for themselves to make sure there's nothing that's changing, there's nothing that's new. And it is such a shocking fact for a lot of people that men can also get breast cancer, because when you think breast cancer, you automatically think of women. So men need to be cognizant of this, men need to be aware of this, and we need to be talking about it a bit more.
Okay, let's spend a second there and ask you, the earlier rule you gave us about the armpit and the collarbone. I want to know if the same rule exactly applies for men. If you are doing a self-checkup at home, what's the set of rules as a guy that you need to follow?
As a guy, do it again once every week. Of course, you're not having a period, so you want to choose one date on the calendar when you do it every month, and you want to check all of your chest area, you want to check your collarbone, you want to check your armpit. That's because the lymph nodes of the area around the breast actually get reflected in these areas. So very often it's one of the first few signs we see of things changing. So it's not just the breast that you have to examine.
Dr. Cuterus, we read of this very, very interesting story of how a mobile van, an outfitted mobile van, went around Pune and actually detected, I believe we've written it down, 144 new cancer cases in 95 days. That kind of going to the people, you think that's the future?
I am so, happy to hear that news, because that is the kind of access we need, because we don't have these nationalized guidelines. Having people, and especially with the amount of stigma that exists around this, having people find that access, come to their home almost, and carry these expensive equipment that often is scary. People are afraid of going to the doctor. So that is very, very exciting news, and that's very encouraging to see that.
Doctor, if we just take the conversation back to overall numbers, I want to quote this. The World Health Organization wants to cut breast cancer deaths by 2.5% every year until 2040. Where is India on that goal?
What's very interesting to see is that over the past couple of years, we have seen a declining trend in terms of cancer numbers. But at the same time, we have seen an increase in the number of breast cancer numbers. So something to be very aware of, something to remember. With that said, if we do reduce 2.5% of deaths every single year, we're saving 2.5 million lives every year. So good numbers, good goal to have. Let's see where we progress from here.
Okay, let's take it now to a very positive place, because what we haven't done from you yet is hear enough of your own stories. So tell us a little bit about a story you may know of a patient who did take ownership, who did get herself checked in time, and how that changed her course.
This has been one of the best DMs I've ever received in my life. So the ABC 143 rule that I told you, I just made that for a reel. And somebody wrote to me telling me that they got diagnosed with stage 1 breast cancer because they felt something different in their breast after doing their monthly self-breast examination. And they went to the doctor in time, so they did get screened. They were following the particular protocols that we do advise, and they got diagnosed in time, and now that girl is completely cancer free.
I want to ask you, doctor, for any woman who might be doing this test for herself for the first time and feeling a lump, how do you know it's a lump? Like, how do you not know it hasn't always existed there? What's the line?
That's the tricky part, and that's why we always encourage regular self-breast exams. That's why we always say do it monthly. It's the same thing as, like I always say, looking in the mirror. If you start seeing your face in the mirror today, it'll take you about a week to understand what your face looks like. And then if there's a new pimple, you'll know something is different from what your face always looks like. So understand you're normal, because what somebody else's breast may feel like may not be what your breast feels like, may not be from, similar to what your neighbor's breast feels like. So get used to what your normal is. Anytime there's anything different from that, a lump doesn't always mean bad news. You can always get it tested, and a doctor is the best person who can, actually check, see if there's any more tests that need to be done to figure out if this is something that we need to worry about or if it's just regular breast tissue.
Okay, so Dr. Cuterus, we've discussed multiple rules today for our audience, and I hope they're able to remember each of the acronyms you've taught us, the number 143 that you taught us. But tell us, if there was almost a way to summarize this, golden words that you wanted to leave everyone watching with, what would they be?
I would say that, I can always tell you about 143 and ABC, but if you're not taking up the time to do it, then there's no purpose of all of this. So time nikalein, screen kare. That is very, very important.
Okay. Doctor, let's now take you to a fun round. It's fun, but we're hoping it'll be very, very informative. It's going to be a little bit like a quick fire, so you can get yourself a little ready. The entire game is called True or Total Bakwas.
Oh, I love it.
You're ready? Quick. You just have to tell us, is it true? Is it total bakwas?
All right.
Number 1. Men get breast cancer too, and it's deadlier because it's found late. True or total bakwas?
True. Men don't even know that they can get breast cancer. So,
how often are you coming about that? Is it every man you talk to doesn't know? Do you 1 in every 10 men doesn't know?
Every time I do a reel on this, I get just shocked comments from everybody that I had no idea this happens.
Okay, I'm going to take to you next favorite one. Tight bras, underwires, sleeping in bras. Lots of fear that it can cause breast cancer. True or total bakwas?
Full bakwas, 100% bakwas. Bras do not cause cancer. You can wear a black bra, you can wear a colored bra, you can wear a bra at night, you can wear no bra, whatever you want. Your breasts, your rules.
Okay, next. Having very dense breasts can cause higher cancer risk?
It can make it more difficult to diagnose it. Dense breasts can be a little bit more difficult. When we do a mammogram, we basically flatten the breast out. Think of it like say you've lost a ring in a big batch of dough. And you can keep pressing the dough and trying to find the ring, you won't find it. But if you flatten it out, you can find it easier. That's what exactly happens in a mammogram.
Roti.
Yeah, we kind of like crush it a little bit. So denser breasts can make it a little bit more difficult to find a new lump. But that doesn't necessarily mean there's an increased risk.
Okay, and one more follow-up question for you. How does one know if they have dense breasts? Again, what does that feel like?
Actually, Indian breasts tend to be more dense compared to the global average. So.
Okay, that's very important to know. Next one. Mobile phones in your bra. If one has that habit of tucking their phone if they're going out somewhere, you know, sometimes people tuck cash.
Yeah.
You sometimes might put your mobile phone and your cash, or you might have a bag that you wear or a pocket. Your phone near your bra, that kind of radiation. Is that an issue, true or total
Your
bakwas?
phone's not a death ray. It's not going to increase your risk of cancer. This is bakwas.
Okay, no fear there, huh?
Yeah.
Okay, here's another follow-up question though, doctor. Are you sure it's been studied for long enough? That's always the question. Longitudinal studies nahi hai. Abhi 40 saal mein pata chalega.
I'm glad you're asking that question. But no, the amount of radiation that a phone does leak out is not so severe like a phone. I'm not talking about actually having a tower. But a phone itself doesn't create that amount of radiation that, you know, it significantly increases your risk or whatever.
Okay, next question. And we've talked about this one quite a bit. Not all breast cancers show up as lumps. True or total bakwas?
100% true. Look for discharge, look for any skin changes, look for anything that looks different.
Okay, next one. A breast biopsy or surgery can actually spread cancer even more.
No. Diagnosis does not spread it. This is full bakwas.
Total bakwas.
Do not be afraid of diagnosis or testing or screening.
Okay, total
Time nikale
bakwas.
screen kare.
Haan ji, fir se. Okay, let's move on next. Tell us, pregnancy before 30 can actually reduce lifetime breast cancer risk?
Yeah, so pregnancy and breastfeeding does reduce your risk of breast cancer, but we all operate on our own timelines. I am more than 30. I am not pregnant, knowing everything that I know about breast cancer and pregnancy.
Let's go to breast cancer is contagious.
Oh no, it's not. This is full bakwas.
Okay. Total bakwas. And lastly, if you have no family history, you don't have to worry so much.
That is not true. Family history is not the only risk factor that we look for. There's lots of risk factors. And I think everybody should time nikalo and screen karo.
Boom! Some wild truths we've discussed with you, Dr. Cuterus. Some legendary bakwas all served up. Cute, and we hope very, very clear for you. No more guessing, no more WhatsApp rumors. Time nikale, screen kare. Those are the golden words of today. Believe in science and love your body. See you next time.